Good evening. In 2026, the hospital management landscape is shifting from volume-based to value-based care, where the human touch is no longer a luxury but a clinical necessity. To maintain a competitive edge, hospitals are integrating empathy-based medicine into their core infrastructure, treating the patient-practitioner relationship as a therapeutic intervention in its own right. Practical approaches to implementing empathy. Empathy must be systematically built in rather than just added on. Below are actionable strategies for modern hospital management. Human-centered design thinking. Map the patient journey, identify pain points, example, long wait times, confusing billing, and redesign these touchpoints with patient advisors sitting on your planning committees. The family updated checklist. Borrow from the surgical safety model, add a mandatory family updated step to clinical checklists to ensure communication isn't forgotten during high-stress procedures. Empathetic leadership and culture. The trickle-down effect. Empathy starts at the top. Leaders must model compassionate behavior towards staff. A culture where staff feel seen by management naturally extends to patients. Hiring for soft skills. Modern recruitment now prioritizes emotional intelligence, EQ, alongside technical competency. Use experiential empathy huddles and role-playing during onboarding to sensitize new hires to the patient's emotional state. Communication as a clinical tool. Active listening. Train staff to listen without interruption, making eye contact instead of focusing on computer screens. Common vernacular. Avoid medical jargon that creates a wedge. Speaking in the patient's common vernacular builds rapport and prevents patients from abandoning care due to confusion. Leveraging technology to restore the human touch. Paradoxically, the latest tech in 2026 is being used specifically to remove barriers to human connection. Technology role in empathy and human touch impact. Ambient AI scribes automatically transcribes doctor-patient conversations into EHRs. Restores eye contact. Doctors focus on the person, not the keyboard. Wearables and RPM continuous, real-time monitoring of vitals from home. Reduces anxiety. Patients feel safe and connected to their care team 24/7. Virtual health assistants manage 24/7 patient queries and scheduling. Reduces friction, avoids the frustration of long wait times or impersonal phone trees. VR for patient education uses VR to help patients visualize their diagnosis or procedure. Empowers patients, reduces fear of the unknown through immersive understanding. Latest updates. Hospital management trends for April 2026. AI as a care partner. New 2026 initiatives like India's Sahi strategy for AI in healthcare focus on ethical AI deployment that handles low-value administrative tasks like insurance follow-ups, freeing clinicians for direct patient care. Preventive care pivot. Hospitals are shifting toward longitudinal care journeys. Instead of episodic visits, management is using predictive analytics to identify patient risks before discharge, ensuring proactive home-based follow-ups. Transparency and ethical billing. Modern consumers in 2026 demand transparent, easy-to-read billing and publicly shared outcome metrics. Hospitals like Apollo and Adhikari Lifeline are leading with patient-centric models that prioritize clarity in costs to reduce patient stress. Workforce reskilling. There is a major push for Industry 5.0 leadership training, where hospital managers are trained to blend high-tech operations with high-touch emotional intelligence. Actionable next steps. To implement these in your facility, consider starting with a technology audit. Identify one administrative task currently burdening your nurses, example, manual follow-up calls, and explore an AI automated solution to give them that time back for patient interactions. CTA, which of these trends will have a major impact on patient care this year? Let us know in the comments. Subscribe to my channel for more. Disclaimer: the information must be verified before use. The creator, publisher, and YouTube will not be liable for any negative consequences.